and we're here talking to Zach Dubeck and his mother, Dr. Marnie Dubeck, and Brandon, brother. And we're home in your house. Now, this is new horizons from the last time people heard from you. Tell us, let's remind people what happened. We won't go too deep into it, but you had this infection that started. When did all this start?
It was the beginning of June, and...
So this is even before school ended?
Yes.
Yes, if I recall. And to remind people, you're a student at Maplewood Middle School now in 7th grade, but this was the end of 6th grade.
And I had a doubleheader baseball game somewhere in the first week of June, and after the game, my knee was hurting, and I had a headache, and I didn't know if I was just tired or what was going on, but came home the next day. I tried to go to school, but I had to leave early because I really wasn't feeling well. And we did a bunch of different things to try to figure out what was wrong, some blood tests, and they checked my knee, and then we finally found out that it was an osteomyelitis.
Which is now, you're an expert in that, I'm sure, after this summer.
It's called MRSA.
Right, and I know there's been several...
Huge scar.
They had to... Now, when they have to operate on your leg, they're basically, we're going in, and Marnie, you can help us with this, they were going and cleaning it out a lot to clean out the infection, correct?
Mm-hmm. Yep, they were
6 different times.
Yep.
So you're in the hospital for a total of how many weeks? Between several hospitals?
At Morristown, which was the hospital that I was for the first
23 days.
23 days, thanks. And then we moved to Children's Specialized
Right,
Hospital.
and that's in New Brunswick?
New Brunswick.
Yeah.
And that was all about rehab and all that kind of stuff, so.
And that was 8 weeks more.
8 weeks.
And then he was actually in a coma, unconscious for what, 2 weeks?
He was 12 days on the respirator, and while he was on the respirator, they give medicine. So it was an induced coma. It wasn't, he wasn't in a coma per se. It was because of the medication they were giving him to keep him, calm and comfortable and quiet, so he wasn't fighting against the respirator.
And Zach, what do you remember about that? Were you conscious, or were you like sleeping, or is it no memory?
I barely remember anything about Morristown. I remember a couple of things, but not much.
And then, for people who don't know, and again, since you're a doctor, Marnie, that helps people understand how much of a serious condition is this, and how much of a miracle and real positive surprise is it that he's come this far?
Yeah, it was serious in that it was absolutely life-threatening. It was unexpected, something that I never would have thought, even as a physician and a healthy 11-year-old boy at the time. So it was something that I guess I wasn't mentally prepared for. I wasn't looking for it. I was making lots of other explanations for why he was feeling sick. So it really was a surprise to, I think, most everybody. Everyone keeps asking, how did he get it? How did he get it? And the truth is, we don't really know.
Some kind of infection gets in the leg.
Somehow the bacteria got into his femur bone, and there was not an obvious entry point.
It wasn't even like he had gotten a cut or a scrape?
Right, he didn't have a bug bite or a cut
gosh.
or anything on his leg. He had a few other scrapes and cuts, but not on his leg there. So it is a little bit of a mystery what let it get there in the first place, but it did, and once it got there, it really shot out into his entire system, and that's what sent him over into what we call septic shock, and he went into respiratory failure, and he had pneumonia, and he had multiple complications, but that's why he wasn't breathing well on his own, and why he needed the respirator, and he was one sick cookie.
And for people who, of course, have been in touch and have heard, you had great support from neighbors and family. Oh, absolutely.
We still do. There's still Maplewood South Orange is feeding us 3 days a week still. and I have offers to drive him to every appointment that he needs. The school, I've said it before, but I'll say it again. Maplewood Middle School, I feel like they would jump through hoops to help us, especially Nurse Porter and the guidance counselor Kevin Smith. They've worked with us, and I feel like they will do whatever Zachary needs to be at school, and it's just incredible. What a great place we live in.
So you came home from Children's Specialized Hospital when? What date was that?
August 26th.
Okay, and we're September 9th. So that's several weeks ago.
Yeah.
And then you still have how much therapy and other, or is it not that much?
Well, in Children's Specialized, I got therapy like 3 times a day, every day. So coming back home, where I can't get it every day, it was kind of difficult to keep up and everything. But I have it 2 or 3 times a week.
And what kind of therapy is this? Is moving muscles around? Is this stretching?
Right now he's got 3 days of physical therapy
Okay.
and 2 days of occupational therapy. So this week we have 5 different appointments. Plus we've got 2 doctor's appointments. It's a lot. It's a lot to follow up.
And
on.
is the thought that the infection is gone, or is it being removed?
He's still being monitored. He's no longer getting the IV antibiotics. We came home, they're following some blood levels, something called a CRP or a C-reactive protein, and that number kind of bumped up a little bit after we went home, so now he's on some oral antibiotics, and so we're following that number with the orthopedist and the infectious disease doctor to be 100% that there's no remains of the infection. So they're being really cautious with him.
And Zach, how are you able to get around then? If you're going to school, that's pretty good, right?
I use the crutches, and I can walk, but I can't walk without my shoe on my left foot, because one of the things that happened when I was in the hospital bed for so long was that my foot fell asleep. So, I mean, it's like when your hand falls asleep and it kind of hurts and you can't really move it. It's the same thing in my
So you still have some numbness?
Yes, I get pain a lot, and that makes it harder, but I can walk without the crutches with the shoe on. Excellent.
And what's sort of the long-term prognosis? Obviously, if you're home, that's good, right?
Yeah, he's amazing me every day. I mean, he went to school the first day with a combination of the wheelchair and the walker, and of course, typical 7th grade. I'm sorry, the crutches and the wheelchair, and typical 7th grader. He said, "Mom, I don't want to use the wheelchair," and I said, "Zachary, not up for discussion." But he has gone into school every day and not used the wheelchair once. So he's doing so well that we didn't even bring the wheelchair today. And he's really doing well. The big thing happened was that we got the approval to weight bear on the right side, the infection side. He was not able to weight bear on that leg until just after we got home. Once they said he could weight bear, it made it a whole lot easier to get up on his feet. But his stamina is amazing. He's going to school, we're going to therapy, we're doing algebra, he's being a normal kid. As far as long-term prognosis, we have issues that we're dealing with. The right side, the orthopedist told us that his growth plate is not going to function where the infection was. So he's probably going to end up with a leg length discrepancy that will be corrected later. So that's something that we'll have to deal with in the future after he grows. And then the neuropathy is going to take a long time to recover. I mean, it can literally take months to probably even years. It's a very slow recovery of nerve tissue. We are hopeful and feeling positive that it will recover. I mean, there's always a chance that it won't fully recover and he will have some lack of movement or strength on that side. But, we just saw our physiatrist who's managing the neuropathy yesterday, and her opinion was that there's no reason that it shouldn't heal. It's not as if the nerve would be severed or anything like that. So I think we just have to be patient and keep up with the therapy.
And Zach, how's the summer, how did you get through the summer? I think that's one thing I was hearing from people. How does this kid go do this? You just didn't get down, or did you get down and just find ways to get yourself up? What was it like?
Well, I always hear from my dad and, I mean, my whole family always supports me in this, and they always say that I'm the hardest worker and I'll hustle my heart out and I'll never stop. And I think, and we all think, that even when I was in the coma, my body didn't stop working, and it kept going and kept fighting. And then, I mean, in Morristown, I was on so many different medications and all this different stuff that I was kind of like, I guess, drowsy and tired and
Were you maybe a little even
kinda out of
too
it.
out of it to even worry? You just
So,
kind of went with the flow?
I kind of didn't realize it, but there's definitely some at Children's Specialized and at home. You know, it's like sometimes I think about what's going to happen in the future, and I just have to take it day by day and stay positive, because if I don't, I'm not going to keep working, and I have to keep working to get this better. So I gotta take it day by day.
And you are 12 now?
12 now.
That's pretty impressive for a 12-year-old.
He's an amazing kid. I said that long before this infection. This has nothing to do with me saying that. I remember when we were in Morristown and he was on the respirator, I would say to the nurses, I can't wait till he wakes up because he's such an amazing kid. And the nurses would give me what I call the head tilt. They would, you know,
They know how to act.
like they think everybody says that. And
Right.
I would say, no, this kid is really special. And I said it before, and I still mean it. He has so much heart. He is a hard worker, and he's an amazing kid. I mean, here the infectious disease doctor told me that a lot of kids that she has in this kind of condition, once they go home, all they want to do is get out of school, and and all this kid wants to do is go to school and be normal and be with his friends and do his work, and he's
Except for
amazing.
algebra.
I feel so lucky that he's my kid.
Don't want to do
Okay, he doesn't want to do algebra.
You're not alone, I'm sure. Excellent. Well, and then so now as you go forward, Zach, how do you sort of look at the future? Just keep trying and keep pushing, and this must give you some confidence in knowing what you've overcome, right?
Yeah, I mean, I have always loved sports, and before this, I loved sports, and I don't know if I'm ever going to be able to be what I was before, but we don't know yet, so we have to wait till that comes. So.
Okay.
Yep, we're
Well-
trying to keep him involved. He's going to his brother's games, keeping the stats.
And you talked about basketball
he's going to
practice.
he's
Now, how do you
going
play basketball if you have trouble walking?
Well,
Good
You don't
question.
worry about it. You just do it, huh?
I'm not going to do any, conditioning or stuff like that, but I might take some shots, and I'll just go to all the practices and all the games to support my team and everybody.
And you never know. You're the last guy they're going to say can't do what he wants.
This kid's capable of anything. I really believe that. I mean, who knows what he's going to be doing in a year, right? Yeah.
Well, excellent. Well,
Hey,
thanks for talking with us, and good luck down the line.
thanks, Joe.
Thank you.